populations. One of the recommendations I would start with is we have several trainings that are always ongoing, and we talked about the issues to do with logistics. But unfortunately, they told us as part of the logistics that is going to be actually, let me say, eliminated. I don't know how best I can call it, but sooner or later we are going to stop using it. Those are the consent forms. And I believe it will affect data, captured data in one way or the other, because for us to tell how many people have been vaccinated, the elderly, the what, we need to have those consent forms to capture their information, because also data management has been a problem in one way or the other, attributing it to human resource, limited human resource, especially in that IT department. But provision of logistics in time will help improve the exercise, and it will actually fasten the process of the vaccination. And then timely delivery of the vaccines, we always make requisitions, we always send in our information before the vaccines run out, that we have currently run out of this, we have run out of this. So maybe some preparation can be made, or emergency deliveries, whatever it is, so that people frequently and routinely come to receive the vaccines. Again, before I leave that issue, is we are going to begin, we have started already integrating vaccination, YCC vaccination, actually the other vaccines alongside COVID-19. We have started it, but again, we need also to have more human resource attached to it, because if someone is doing vaccination for babies, doing vaccination for pregnant mothers, doing vaccination for hepatitis, vaccination for 10-year-old, still at the same time vaccinating COVID-19, so it's not feasible when you look at it. That's when we shall have errors coming in, and we shall be having adverse effects following vaccination, or what we call side effects for vaccination, because one person cannot run those several vaccines at the same time. So that's why we need at least a human resource to be stepped up in some areas. Some areas might be having enough human resource to cater for the exercises, but other areas are still compromised depending on what is available. Then looking at the adverse events following vaccination or the side effects, we have always and routinely recommended that whoever is going to carry out a vaccination exercise, please start with introduction, go on with the health education, bring out so well the side effects of the vaccines that will be anticipated, or most probably would occur or may not occur, because not all side effects that are stipulated occur, but there are some that will always occur, and these clients need to report about these side effects, because National Drug Authority needs to capture them, and most probably at a certain level they need to investigate whether it is a vaccine, or it was an error, or it was a patient. There's what we call concurring events. Maybe the patient had malaria, that's why the fever shoot up. So these things need to be written and documented very well so that they can easily be followed up. The other thing that we have tried to cater for when you look at the vaccination card for these clients of ours, we got stickers from Ministry of Health, and good enough. These stickers are too many. They are enough for our clients. We request if the supply can be consistent. It is a sustainable process, but the supply, if it is interrupted, then it will affect also the reporting and the management of the side effects. We put the stickers behind the clients' cards, and we tell them, in case you get this problem, please report. And it has improved on the rates of the reporting and the investigation for the clients that have had adverse events following vaccinations. For this other specific category of people, I would recommend, this is my suggestion, I don't know how best it could be done, for the people who have suffered from COVID-19, because every client who comes to our facility, we track the vaccination status and we attach it to the patient's chart. It is in my view, as I don't know if it can be brought up as a project or as a survey, that whoever we discharge from the facility, we need to do a follow-up to ascertain if they have fully recovered that period they have given of 3 months. If it is done, have they been able to go and receive the vaccination status, because they are not fully immune already. Important thing I wanted to talk about was on the issue of the vaccines. When you look at the vaccines we are issued, they have different expiry dates and they have different storage conditions, and they are actually of different varieties. So when I begin the exercise of vaccination, I normally first display the vaccine to the clients to show them that please, whoever is receiving this kind of vaccine, it is here. Come and read on it. And actually they read and confirm it is a vaccine. Most of them always want to look at the expiry date and the country of origin, of which we also normally do what? Display, because others have different tests on different countries of the vaccines of origin. So when I display the vaccine, they normally have that belief that yes, it is a vaccine when it still has its cap, when it has not been opened. They still have that belief that when you give them a vaccine that has been opened, they think maybe you have affected, you have maybe put in some other things that they do not know. So once you show them the vaccine, when it is still sealed, they believe actually this is a vaccine. So that's why you see some other people take long distances from wherever they are staying, and they come to take the vaccines from different sites. They normally have their reasons for coming to these other different sites. So one of the reasons why it is being done is to pick that acceptance from these clients that whatever I've received is a vaccine. Not water, not whatever item has been put in the bottle as a suspension. So it is a very good practice. It has helped us with our clients, and actually it has improved on the coverage of those vaccines, those people who are coming in for the vaccines, because of the reason, because of the nature of how we do it, by first showing them what we are going to give them, and by telling them, actually the other thing we normally tell them is the return date, regardless of writing it on the card. We tell them the return date, especially for those ones who cannot remember. But for those ones who can remember, it is easy for them to memorize. So it has also improved the uptake of the vaccine in this health facility. And I thank you so much. There are so many other things that we always normally do, but the uptake of the vaccine has been very good here in our community, in our facility, as we have been supported by the hospital, because we cannot do it alone in one way or the other. We cannot. So we thank the hospital administration. It has been there to support us, as well as the entire community, the mobilizers and everyone, for having the vaccines being delivered to the clients that are eligible for the vaccination exercise.